with today's webinar, what we are going to do is talking about evaluation, but we're talking about it a little bit differently. And when I sent in the description, those of you that may have read it, when I said it's not an evaluation is not a dreadful task designed to make the life of a coordinator miserable, I got a little pushback from that because that's not what evaluation is about, and we know that. And so what our goal is today is to talk about how we can do evaluation, and hopefully by the end of today, we'll be able to see we can do evaluation without even using the word evaluation. What we're doing is using the work that we do that we talk about in the academy to look at those products for different uses. So what we're going to do is to look at how we use the data and the information from evaluation to do our work in a coalition without, again, really even know that we're doing an evaluation. We do have, looks like we have less than 90 minutes. We've got 73 slides, so we are going to keep moving, and we are going to, you're able to see the transcript at the bottom of the screen. Am I missing something there? Brittany will remind me.
Nope, you're good, Dave. That was for somebody else. It just happened to go to you too.
Okay. Oh, see, that's the, okay. So what we want you to do, if you haven't already, put your community, your coalition, your cohort in that you're attending of the academy, place a comma between each and then press enter. And if you love evaluation, tell us why you love evaluation. So again, this is to limber up your fingers. We'll give a second if anybody else wants to add anything. Many of you have already been good in typing in the chat box. Okay. Great. Never heard of Daramisakota, Maine. Thanks for checking in. Excellent. Patch Coalition in Oklahoma, the Paris cohort. Is at Paris, Texas. And just for people's information, my name is Dave Chevelle, and I am a trainer with CADCA, been a trainer with CADCA for quite some time now. And I'm presently training with Colbert in Pittsburgh, so Brittany's hometown, and then also training with Dylan in Leadville, Colorado, the highest city in the nation. So we have a prevention from, hello, Leanne, and our folks from Washington State, right across the river here. It's great seeing everybody. Again, a lot of folks that I've done work with in coalition development support. So we just appreciate all of you taking the time and taking advantage of these learning opportunities provided by CADCA. So with that, thank you for that. What we're going to do is going to do a 2-minute check-in. Your trainers may have done this. I can't wait to hear why I love evaluation. You will love evaluation. So what we're going to do is warm up with a 2-minute activity. The first minute we'd like you to do is, your trainers may have done this, but we'll see how many uses we can find of a paperclip. This is just to get our mind and our fingers limbered up. So in the next minute, I'm going to time it. How many uses of there are a paperclip? And put those in the chat box, please. And see, okay, we'll read some of these. Netflix, comparative weight. Oh, I've never had that one. Toothpick, unscrewing things. And Brittany's going to be counting here. Pick a lock. Just close my Chex Mix box. Paperclip, shower clip, money clip, center cable box. Reset, I love it. Button for pants, fold open locks. Decorate with kids. Fiddle gadget, exactly. We all fiddle with our paper clips. Bookmark, buttons, fidget toy, fishing game with, oh, that's right, fishing game with kids. I love it. Hairpin, bobby pin, bracket holder. We're down to 5, 4, 3, 2, 1. Brittany, how many did we get?
21. No, sorry, 26.
Okay, and actually MacGyver's everything tool at 27. No one's mentioned holding paper together, so we'll give it 20.
We did get someone saying holding paper together, but we didn't get that Christmas ornament holder too. So I'll give you 28 for the paper clip. 28.
What we want to do now is just to think about what are all the uses of an evaluation. Let's see if we can beat 28. Let's see if we can beat 28 uses of an evaluation. Ready, go. I love it. Again, these are all evaluate, coalition, make adjustments, celebrate, asking questions, ask interesting questions. Wow our friends at parties, improvements, find gaps or faults. I love it. Determine if intervention is appropriate, assessment for changes, learn for the future, find gaps, marketing, great, set positive, allocate resources. I love it. Coalition calibration, right? Let's check, make sure what we're doing, engage stakeholders, for stakeholders. Measure change, learn new skills. I love it. Inform the community. Okay, we're up to determine community engagement, validates our work for fun. Yes, it can be fun. Grant writing, focus programs. Let's see, 5, 4, 3, 2, 1. How many did we get?
5, 10, 15, 20, 25, 35.
35, excellent. So you've done better than other coalitions, other groups that I've done with this with. We've got 35. Yes, there are more uses of an evaluation than for a paperclip, which is always nice. So what we want to do is, again, focus our session today. The whole session will be based on, and I don't think we've missed too many of what you put there, but when we've done this before in our trainings, we talk about different uses, and I think we've covered a lot of them here. We are going to go over these 7 different uses, and if you have questions or want to add anything as we go through this, please ask those as we go through. Brittany will be monitoring the chat box. What we're going to do is, again, if we can talk to our coalitions, and I said this before, but not even use the word evaluation, is we need to collect some information so we can get funding. We need to collect information so we can adjust plans. We need to use information about what we're doing to do all those reasons, and we don't even use the word evaluation. People won't be put off. People may say, yeah, I can work on celebrating success. I can work on recognizing coalition members. So again, thank you again for putting the slides in the chat box. So the whole point of today is to be able to talk about the uses or the functions of an evaluation and use the ingredients, if you will. And these ingredients that we'll use to do all these things, these 35 different uses of an evaluation, are none other than those products that we've talked about in the academy. And so again, all of you know about the community assessment, the logic model, strategic and action plan, evaluation communication plan, and sustainability plan. If we do all these, and I've added one, and I'd encourage you, if you have it handy or nearby, pull out your week 2 workbook, and on page 101, remind you there is a coalition output worksheet. Again, this is it's not one of the required products, but it's one of the tools that we provide. Essentially, all of these products, if we do these, and I'll say my ulterior motive, my objective in putting together this webinar was to see that having the products that we talk about in the academy are useful to the coalition other than just graduating from the academy. And so what we'll see here is we will use every one of these products to do these uses or to achieve these functions and many more. So again, it's not about doing evaluation, it's about getting funding, celebrating success, making adjustments, building ownership. We use these products to do this. And if you think about it the way we talked about it in the academy, the process of confirming data on our logic model, this process holds. If we have a good logic model, if you've been attending the academies, you've heard this many times, logic model drives what we do. The data on the logic model drives what we do for our evaluation. It drives what we do for telling the coalition story. All this is about, in some way, every use that you've identified is telling the story about what we've done, celebrating, making adjustments. What have we done so far? What do we need to do to improve what we're doing? So if we use our logic model, if we're able to document our coalition work, that's where that coalition output form, or however you're documenting, here's what we have done, here's what our coalition has contributed to the work, to the changes in the community. That'll allow us to tell our story. And if we can continue to collect that data over time, then we can continue to tell our story. We can continue to make those improvements. So all that to say is, again, I'm just repeating myself, that these products, if we do these products and we use them and we keep them up to date, then we're able to do our evaluation and we're able to do all these functions that you've identified. So what we're going to do is, for the rest of the time, is to walk through these. If you have examples, we encourage folks to borrow heavily from each other. So if you've done any of these things, if you've written a case statement, if you've got an infographic sharing your success or celebrating coalition members, when we get to that point, please put the link in, put your name in the chat box. I'm going to be stealing from you so we can share as examples of work that coalitions are doing. So please feel free to share your examples. And unfortunately, you can't chat. I would love to be able to have you share, but in the chat box, share how you've been doing or share challenges in doing some of these things. So the first thing is we're talking about is, and there's no particular order for these. I started with get funding because it can be the funnest way of looking at using evaluation information or using information. So when we look at get funding, this will be a quick 1-minute chat box activity. See if in 1 minute you can chat. If I have $1,000 and I want to donate it to one of your coalitions, make a sales pitch of why I should donate it to your coalition. So you have 1 minute to type in the chat box. Why should I donate? There's probably what, 45, we have 59 people. So Brittany wins our poll. We have 59 coalitions on the call. Why should I donate $1,000 to your coalition? We'll give you a second to type. And so you've in 1 minute to type. We do this activity at the Academy in week 3, so you're getting a jump on it. Again, Tina, we can better market our cases. So that's why you need $1,000 from yes. We can, that's too many grants. We want to give out money to our, so tell me why I need to give it to your coalition. So we can give mini grants. What do the mini grants do in the community? Thank you, Lori. What else can I do? We're all about helping you thrive. You can be part of positive change in our community. Thank you, Amy. We'll give folks. Investing in prevention is cheaper than treatment. We need to say, yes, exactly. An ounce of prevention is worth a pound of treatment. We have a little youth engagement. Oh, you already know how cool One Prevention Alliance is. So part of it is letting the people know, working hard to learn the science of prevention, implement. Our community is unique. When you've seen one community, you've seen one community. When you've seen one coalition, you've seen, these are all excellent. The whole point about it is when we have good documents, we're able to tell the story about, again, what is our coalition doing, why we should be worthy that we're asking people to donate their time, their talent, their treasure, their volunteer for the coalition, donate their resources, donate their skills, donate their money to the coalition. We need to be able to make the case. And this evaluation data, again, tells us Omnia, if I'm saying that right. We have specific groups of underrepresented young people. We need to provide them recovery prevention services. That's exactly the case. So when we talk about funding, there's an old saying, funders don't necessarily fund the greatest need. What they do is they fund the ability to make a difference. So what we need to use is use these products that we've mentioned to be able to tell the story of how our coalition is making a difference. And this is a little heads up for week 3, but you'll be, I think most of you have the week 3 workbook. If you turn to pages 67, 68, and then 76, you'll see what we have is our sustainability plan. So I'm giving you a little preview of week 3, but essentially for funding, funders ask 3 questions. Basically, everybody has a need in their community. Every community you go through can identify some need that they have. But what we need to be able to say with our work is to be able to say, what is that need? And then how does our coalition make a difference in addressing this need? Again, you can be part of that positive change. What is the coalition doing to achieve that positive change that have decreased youth marijuana use? And so what's unique about the coalition? So again, and I'm going to put this in the chat box. And again, this is in your workbooks. It's already in your week 3 workbooks if you have those handy. But I'm going to put the case statement worksheet in the chat box. And I'm going to put the, where'd it go? Just, yeah, the case statement worksheet in the chat box I just did. And what the case statement worksheets, it asks you those very 3 questions. What is the need? What is the coalition doing about it? And what is unique? So what we want to be able to do is the first question that every funder asks, what is need is being addressed? If you have a good needs assessment, community assessment and needs assessment, and you have a good logic model, you can answer that question is we've looked at all this data in our community, we've done prioritization, we've engaged the community, we've identified underage drinking, the root cause of favorable youth attitudes, and these are the conditions we're seeking to change. So this is what, it's not just we have a drug problem. No, we can be very clear about what aspect of the drug problem we're taking on. So those of you, so Karen wants her $1,000. Yeah, I'll give it an in-kind volunteership with your coalition. So again, in your case statement, it asks, what is the need? You have that information. If you have a community assessment and you have a logic model, you can answer that question. Every grant asks this. And this is all on the case statement worksheet. Here's an example. If you can't read this, and you're not supposed to read, I'm going to read it. I stole this from an actual coalition case statement. I tried to change the name of the county. Hopefully I did. NBC News had referred to Ohio as a ground zero for illicit fentanyl use and referred to Montgomery County, I think I changed the county, as the center of the opioid epidemic. Data shows that this county has been the highest rate. It is no secret that the county has been hit hard. In fact, we saw 506. So they've done a good job here of making the case that there is an opioid problem and a real specific information about their problem. And so again, we can use our logic model and community assessment to do that. The second question that they ask, funders ask, is how do you make a difference? What do you do that makes a difference? Well, we can talk about how we use data to drive our strategies, and our evaluation plan shows how we track that data. Our coalition work output is here's what our coalition has done. Here's how we've contributed to this change. So since implementation of AAA County Prevention Coalition in collaboration with other initiatives, we've seen a 49% decrease in accidental overdose, 53% decrease in overdose calls. The Highway Patrol has reported a 7% decrease in OVI. We've only been around since 2017, but we've made great strides related to supporting these outcomes. So again, we're using data to drive and be able to mention the case that there's a problem, there's a need, here's what we're doing to address it. I want to know more about what they've done, how they've achieved these changes, but we're telling that story. And again, it's data from your community assessment, logic model. You can talk about your evaluation plans and also talk about your outputs. Here's what we've actually done. And then the third one, what is unique about the coalition? Here's where we get to continue telling our story using the strategic and action plan. And again, that coalition output worksheet, which is on page 100 and 101 of your week 2. It's be able to say, you know, here's what we've done. Their partnership is an alliance of diverse community members from a variety of stakeholders, implemented over 50 strategies we've evidence-based strategies. We've reached over 20,000 residents. Overall goals are to increase systems with over 75 local governments. So they're talking about what's unique about the coalition, how here's what we do to bring people together to address this issue. And again, this information is what we have in our assessment. It's in our resource assessment, where we've identified who are our partners. It's in our strategies. We can identify who are all the partners we're engaging in our strategies. We can look at our action plans. And then our output document says, here's all the work we've done. Here's how the partners have contributed to that work. Any questions or comments in the chat box? So again, what we're doing is able to tell the story of what is the need, what is the coalition doing to address that, what is unique about it, about the coalition. That's all information we already have to be able to tell this story.
Nothing in the chat box or Q&A box right now, Dave, but just to let everyone know that all of the resources that Dave is dropping in the chat box, I will make sure to pull and also get up on the supplemental webinar page.
Thank you. I've also put that in, and we can put that in again, the list of these sources. So I'm just going to continue, and this is on that list of sources. CADCA does this, and Sue Thao, if any of you know Sue, and we should all know Sue, and thanks, Sue. This is from 2019. It's written testimony to the Senate Committee on the Judiciary Tackling the Opioid Crisis, a whole of government approach. So this is CADCA, Sue Thao's report to Congress. So she's telling the same story. In this report, she talks about what is the opioid problem, but then she says, here's what's unique about drug-free communities. So this is from the report. The remainder of this testimony will show how 3 different coalitions, and she cites case studies from coalitions. And here's what we do. We build the capacity. We use local data. We use multi-sector comprehensive strategies. If you're writing grants, I encourage you to steal this or borrow this language from Sue that's in her testimony to Congress. This is what coalitions do. This is part of telling that story. We evaluate the results based on data to show stunning, Sue's words, stunning reductions in youth opioid misuse, opioid overdose rates, and other relevant metrics. So again, we're data-driven, we're using evidence-based strategies, building partnerships. So CADCA is telling Congress this, and this is why DFC funding gets funded year after year and on an increasing basis, because CADCA is able, through your work, through your evaluation, to be able to tell the story. So you all, those of you who are DFC, have to report your core measures. This is all part of your core measures, and it's data on your logic model that describes your problem. Here's what she's showing from 6th grade from 2006 to 2016. We've seen, these are stunning, drops in 30-day prescription drug misuse by 8th, 10th, and 12th graders over that 10-year period. She's also able to show that over a 5-year period, this is one of the counties. And so the blue is 2013, the orange is 2015, the gray is 2018. For tobacco, alcohol, marijuana, and prescription drugs, this community has shown significant decreases. So again, this is exactly what CADCA is telling Congress about why we need to continue funding. None of this is anything different than what you've got in your community assessments, your logic models, strategic plans, evaluation plans. So to wrap this first section up, the key points, every funder asks, what are conditions in your community? Are you using a data-driven process to establish your priorities? Are you using evidence-based strategies? How are you engaging community partners? And how are you tracking your data? How you know you're making a difference? And if you do this work, you can use your community assessment to describe your community conditions. Your logic model describes data's driving your priorities. You can see here evidence-based strategies. We've got those in our strategic and action plans, community outputs, how we've engaged community partners, and our outcome data. These are the data we're tracking over time, which is basically our logic model. So again, we're using these tools to be able to, in this case, get funding to tell our coalition story. I'll take a breath here. Questions, comments, challenges. If you have examples of what your sustainability plans, we'd love to see it.
Nothing in the chat boxes.
Okay, okay. Okay, so what we're going to do is keep moving. Another thing that many of you have put when we said, what are the uses of an evaluation, is to adjust our plans and strategies to ensure accountability. And this, again, is critical. That's why we do evaluation. But again, we don't have to tell our coalition, oh, we're doing an evaluation, who wants to join? Who wants to look to see if whether we're doing is making a difference and whether we need to adjust any of our strategies. So it's how we phrase it. So the way we do this, we start, if you think about it with our logic model, we don't have you write those objectives just because we want to make your lives miserable. We write those objectives because that is our guide to say, in the long term, are we achieving the changes in the problem? In the intermediate term, are we achieving changes to our root causes? In the short term, are we achieving changes to our local conditions? So when we write those objectives, and this is straight out of our strategic and action plan, okay, so again, it's in the workbook. Again, toward the end of this, if I have time, I'll try to put the coalition out. It should be on your, if you're on the Academy, the coalition output document should be in the workstation, but we'll make sure it gets in the folder here as well. Thank you for that. Oh, Brittany, you are on top of that. Brittany put the coalition output document in the chat box. Thank you.
I think that's the right one. I think it might be an older version, but I think it's the updated one, Dave.
Let's check. Yep, that's it. Excellent. Okay, so we back to the PowerPoint slide.
Yes, sir.
Okay. So when you look at it, the short-term objective, when we write that, it's short-term, 6 to 24 months based on our data. So here's where we've got underage drinking. We're looking at availability. We want to see a decrease in retailers selling alcohol to minors. So we can see when we do compliance checks, we had 20% by 20% from 25. So 1 in 4 retailers failing to 5%, 1 in 20 failing in 2 years. So we can check this. We don't have to wait 2 years. If we do compliance checks periodically, and you all know this, we can do this. So again, if we have good objectives that we've actually engaged the coalition in, we can look back and say every year, every 6 months, let's look at our objectives. Did we achieve what we wanted to? Tell me if it's not as easy as it sounds if you have good objectives that are based on good data on your logic model. And so again, in your evaluation plan, this is one of the products we talked about in week 2, you're actually listing the data you need to track. And if you think about it, for a logic model where you've got 1 problem, 2 root causes, and 4 local conditions, that's only 2 pieces of data each. That's only 14 pieces of data you need to track. And if you think about it in the short term, for your short-term objectives, if you have 4 local conditions, that's only 8 pieces of data we need to track. It may be we need to do a focus group every 6 months with youth to ask questions related to our local conditions. It may mean we need to go interview some key informants every 6 months related to our local conditions, or do compliance checks or observations. But it's very clear what we're looking to see, are our strategies making a difference? Again, this is all here in the products that we've talked about in the academy. And then finally, that allows us to go to our strategic and action plan and say, okay, maybe we said we'd only have 1 in 20 retailers that are failing compliance checks. They're still failing. So what do we need to do? Are we putting out signs? Are the fines not high enough? Have we advertised the penalties? Have we provided enough responsible beverage server training? It allows us to go, and this isn't anything new. But if we use these products, we can say, do we do enough? Did we reach every retailer? We have 220 retailers in our large county. How many are we actually reaching with these plans? Are we getting enough dosage? Are we getting enough penetration into the market? But if you have, again, good products, you're able to use those to say, how can we, again, adjust plans and ensure accountability? Or again, maybe the compliance checks aren't being done. How can we support our partners in doing those compliance checks if that's the case? Or how can we make sure we're providing responsible beverage server training or tips training to every retailer, making that available to every retailer in the county, in the community? And what's interesting, those of you that have applied recently to the drug-free community, they started to use this language coming from the CDC. This is a screenshot from the drug-free community CS. I'm using $1.50 in acronyms here. The CDC RFA for the DFC in 2021, but this is the request for application. But they're asking coalitions to say 4-year goals, either strengthen community collaboration or decrease substance use. But what are you doing in the short term? What are your intermediate and long term? So funders ask for these, and it's just a matter of actually using what we write in these boxes for our objectives and saying, are we achieving what we said we would? Funders look at it, our coalition can look at it too, if I can use the term, take these objectives seriously. So I'm just going to try a scenario here. Let's check the chat box. So this is the coalition has analyzed its data from 2020 and realized that none of the objectives are moving in the right direction. So we look at our data, and specifically we've seen an increase in prescription drug use, an increase in perceived availability, and we see our local condition that youth are getting prescription drugs for home. We've actually seen an increase in that. Which coalition products would assist in this discussion? We want to have a conversation about what can we do. So just a quick, if this was a case where our data isn't moving how we expected it to, what coalition products can we look at that'll inform us, go back to that product list, that can inform us about, we go back to our logic model and say, are we using the right measures on our logic model to really measure our youth getting prescription drugs at home? Thank you, Lydia. What else can we look at? What other products can we look at? Community assessment, that tells us, yes, what are other reasons? Are they really getting it from their home? Maybe that's not, there's some aspect of that. It's maybe their friend's home. And so we look at our assessment, what do we know? Look at our logic model. Strategic and action plan, thank you, Casey. Let's look at our strategies. Are we, again, really implementing the correct strategies? Look at our action plan. Thank you. Go down to that level of detail. Thank you, Cameroon, and I owe you a review. It's Cameroon, excuse me. what we want to do is be able to look and say, did we do what we said? Did our partners do what they said they're going to do? You've all got this. The point is, if we use these products, we have everything we need to do to make these adjustments. Review the local condition carefully. Let's make sure, do we identify the right local condition? Are we reaching everybody? In this one, youth are getting prescription drugs from homes. Again, COVID makes it harder. What adjustments do we need to make? Let's adjust those strategic and action plans. Exactly. So again, and the whole point I'm trying to make here, it's in the products, and we just have to, in some sense, just, I make it sound simple and use these products. Comments about this. Again, the whole point is, and I think what our goal here is, and I'm saying, I'm repeating it, is to move from the products being just something that we submit to CADCA for, so we can graduate, to let's actually use these products with our coalition, because when we do, we're doing an evaluation. Our coalition members don't even need to know they're doing an evaluation. We're just doing these different functions. Okay, our third piece of using an evaluation is increased readiness. And it's really using the tools, the products that we've already talked about. For those of you that, again, we covered readiness in weeks 1 and 2. Readiness is, again, how people are ready. There's kind of 2 levels of readiness, though many of you know. One is, do people even think that drugs are a problem, or that prescription drugs or that underage drinking, a particular drug, is a problem? Do they really think a local condition is a problem? So part of readiness, there are 2 aspects. Is one, our people know that there's a problem. The second aspect is, are they aware that there's a coalition that's putting together strategies to address and come up with a solution to that problem? In order to increase readiness, we need both, to raise people up and say, from denial and saying, yeah, there's something we can do about it. What can I do? That's where we need to say, yes, there's a range of strategies that we can do. So again, the way we build readiness is by sharing information about the root cause, the problem, the root cause, local conditions. Where do we get that from? Our logic model, our coalition partners, and what we're doing and our strategies. We get that from our strategic and action plan. What are our strategies? We get what we're actually doing and how our partners are involved from our coalition output document. When we record our activities, we'll record the meetings that our coalition's involved with. We record everything that we're doing, and sharing that, we can let people know that, yes, there is a coalition out here addressing this problem that we need to be addressed, and we have strategies that can work. We need your involvement. So this is an example, and this comes directly from a logic model. CADCA put this together in the past as part of our ORN project, and I'm going to share this flyer if I can. This is a flyer that CADCA put together. It's 4 megabytes, but basically it's trying to get people to access the syndemic toolkit. The point here is we can create one-pagers. A lot of you have the ability to create one-pagers that raises readiness, and we're using data from our products to do this. You can see on this flyer that we talk about what is, and this is using national data because the CADCA is putting it out. You can adapt this for your coalition with your local data. But we've seen in COVID-19, we've seen an increase in opioid use. Yet here's what we're doing about community collaboration is the key. We talk about the 7 strategies, and then we talk about, hey, you can find out more by accessing the toolkit. Thank you. I forgot ORN, Opioid Response Network. Thank you, Brittany. I owe what, $2.50 now, at 50 cents an acronym. Essentially, a one-pager can raise readiness by letting people know there is an issue in our community. There is some people working to act on it. Here's what we're doing. Here's how you can get involved. We can put all that in a one-pager. And again, that's just using information from our coalition products. Here's another example of just increasing readiness and moving toward a strategy. Again, this is all data from our logic model, from our strategic and action plan. So again, this is in your week 3. So those of you that have already received your week 3 workbooks, you also get this. It's on page 19 and 20. Essentially, it's called an issue brief. And this is from Petaluma, California, a couple of years ago, where they were putting together social host ordinances. It's a 4-page issue brief where they're using the data from their assessment, from their strategies to say, hey, there is a problem with teen parties. Parents are allowing to have parties. Parents need to be responsible. We're proposing this law. Here's how the law is effective. Here's how we can make a difference as a community. Here's the cost benefit of doing this. So the whole point is, if we have, again, I'm going to say this throughout, and you're going to be sick of me saying this, if we have a good committee assessment, a good logic model, good strategies, we can put these information together, these one-pagers, these flyers together that drive our strategies, that increase readiness in the community. So any questions about readiness? Again, I just said this, how about that? The logic model describes, so again, we base and we're giving confidence to people that we're not making this stuff up, we're basing it on data in our community. And the strategic action plan says, here's what we're doing to address that. I would add to this, in our evaluation plan says, here's the data we're going to collect over time to measure we're making a difference. So again, these are all in our coalition outputs described. Here's actually what we've done. We can build a case to say, here's what we're doing. All that will build people's readiness to join in, to say, yes, there is a problem. Yes, there is strategies being put in place. Yes, here's how I can get involved. Questions, comments? About halfway through our webinar. How about that? Give everybody a chance to take a breath here. Questions, comments, any examples of flyers you put together to raise readiness? We'd love you to share those in the chat box if you're able to. Okay. Next piece is number 4. We use, and a lot of you came up with this, we want to celebrate, but here's where we're telling, it's really about telling our coalition story to our funders. And when we look at the broad funders, that's to anybody who's donating their time, talent, treasure, all our volunteers, all our partner organizations, that they may not donate money, but they're donating resources. They have their staff come to our meetings to address our strategies, to work together. So again, telling the story is the funnest part. I know funnest isn't a word, the most fun part of doing this work when we've got the information to share. And we do. We have a good, you're going to get sick of me saying this, we have a good logic model, good strategic and action plan, evaluation plan, and outputs, we can tell the story about what we're doing. And again, if we have these in our coalition outputs, again, if you're unclear about the coalition output, there are lots of ways to collect this information. The whole point is here, let's document everything our coalition is doing, because that's all part of telling the story that in all these different ways that we're talking about. One way that you have to use the story, though, this information to tell the story, those of you who are drug-free community coalitions, you do have to report to DFC-NE. A lot of information goes there. And again, a majority of that comes from these products. If we're capturing all this information, whatever our funder is, they're asking for what is your priorities? What are your objectives? What are you doing under that? How are you engaging the community to do this? That's all already embedded in these documents. And again, this is on the web. It's in the list of sources, but this is from July 2020. ONDCP, Office of National Drug Control Policy, does report to Congress to be able to say, just as Sue Thao did for CADCA, to say, drug-free community, here's our evaluation, it's making a difference. And they tell this story using the same information. This is all based on information you put into DFC-NE. They can tell you that percentage coalitions that are engaging in recruitment and outreach and training. They can tell you the number of coalitions that are doing this. That's part of saying, here's what our coalitions are doing. They're activating, they're engaging their communities. And so this is wonderfully explained in that report to Congress. Then they're able to show, yes, we are engaging in different strategies. 62% of coalitions are changing in physical design. 70% are enforcing, informing, or modifying about policy changes. That's great. We talk about evidence-based environmental strategies. 70% of coalitions are engaged in this. So again, it's going to Congress and telling a story. These drug-free communities are building partnerships to do all this work. 99% are providing information. That's what we do. And so again, here's what we're doing, here's our strategies, and yes, we have good outcomes. So every one of these, what they're showing, this is all DFCs since the start, however many years ago, 19, 20 years ago. These are the 2018 cohort. But basically, they're all showing for alcohol, tobacco, marijuana, prescription drugs. Marijuana is a little bit less, but they're showing at middle school and high school. These are all decreases when they compare DFC communities to non-DFC communities. They use, I believe, the household survey to be able to compare those who are DFC, those who are not. And it works. When coalitions do these things, when they engage in these strategies, we see these changes. So being able to celebrate, yes, this is all we've done. Okay, Christina emailed the report. Hopefully we'll be able to get it. I don't have time to check my email, but thank you for sharing that. I'll build it into the next presentation. Thank you, Christina. Again, let's share as much as we can. This is from the Milton Substance Abuse Prevention Coalition in Massachusetts. I don't know if you're on the call, let Brittany know and she can make you a panelist. You can tell your story. But they won Coalition of the Year, so they won the CADCA God Outcomes Award. But they put together this 5 years of building valuable community partnerships. And we put the website here. This is from 2014 to 2019. And they were able to tell the story. So they recognized their outputs. They had 2,000 people viewed their resources. This is in 1 year. 750 people in Milton's a small town received, I think, their newsletter. You can see this, 1,000 students benefited. So these are just those process numbers. $125,000 of drug-free grant, and I would add to that plus $125,000 of match is $250,000. In 1 year, they send out 12 newsletters, 426 pounds. So these are all those outputs that we're able to recognize that contributed to, again, we don't take full credit, but they're showing, again, what we're looking at is this is 30-day use over the last 4 years. They've shown decreases for male versus female for 30-day use and binge drinking. So they're able to say, again, here's what we've done. Here's our outcome. So when we collect this data over time, we're able to tell these stories. And I encourage you to go out to that Milton site. They did win Coalition of the Year. Again, just borrowing heavily from coalitions. This is the Mercer Island Healthy Youth Initiative, and I did get permission to share if you're on the call. Thank you. But basically, they just participated in our Graduate Coalition Academy, which you are all welcome to join that after having participated in the National Coalition Academy. And they went through it. One of the outcomes of the National Coalition Academy is to create an infographic telling your coalition story. So this is from Mercer Islands. I borrowed pieces of it. They may not have put this yet on their website, but basically in their story, they said in 2000, this is their 10-year trend of Mercer Island high school students reported using marijuana regularly. We've seen it gone from a high of 35% down to about 22%. So we've seen a decrease in use of marijuana, sharing their outcomes, then sharing their outputs. And I love the way they did this. They've seen a decline in perceived availability from a high of 42% of their youth were reporting that they think alcohol is easy to get. Excuse me, this is marijuana. They think marijuana is easy to get. It's cutting almost in half down to 22%. And then that's over that 10-year period. And how have they done it? Our coalition stays informed. We share the facts to people. So they've been sharing information. They've been advocating for, again, Mercer Islands in Washington State, where marijuana is legal. And they've been advertising for no marijuana retailers on Mercer Islands, an island near Seattle and Lake Washington. And they've had conversations. They've got a youth initiative where they've been engaging young people. So based on all this is how they've contributed to the decrease in availability, which has contributed to a decrease in youth actually using marijuana. This is all how coalitions tell that story. Again, and these are all, I was just in Narragansett yesterday, in Narragansett, Rhode Island, their website, I don't know if they have this on the website, but when they went through Academy, they shared this. They're just putting back 5 years later. They're able to see, if you look in the middle here, their document, it's a full large document, but over 2002 to 2013, in 10 years, they've been able to show changes in alcohol use, marijuana use, tobacco use. And then looking back, looking ahead, here's what we've done, here's what we're continuing to do. So it's all part of telling that story. And one more, this is from the Anti-Drug Coalition. I believe it's in Indiana, if I remember right. If I'm wrong, correct me. But basically, this is the way they're telling the story. Youth engagement in drug prevention in our community. In 2016, they had just 2 students from one of their high schools. By 2018, just 2 years later, what's that? Looks like they got about 30, 40 students from both high schools. So this is part of telling that story of how they're engaging the community. All this can be on our coalition outputs, can be on the documents that we're using to track what we're doing. And there's one more. This is from the Safe Marin County in California, where they've got their opioid safety data report card. They're using this data to tell their story and the amount of medication. So looking at the local condition of youth that are getting medicines from their home. This amount of medication safely disposed of will increase 10% annually. This is their actual trend that they've been able to show. They wrote this objective and they've been able to show the data. And then here's what they're doing to promote people turning in their their unused prescription drugs at the drop-off location. But again, they're using none of this data we don't have on our logic model, strategic and action plans, evaluation plan, or coalition outputs. See, there's a trend here. These products are useful. And the last one, I won't go into it, but if you do an example of substance use in Philadelphia, this is not necessarily related to a coalition, but I love the idea, and I'd love for someone, if you could, the reason I'm putting this up here is if someone has a data dashboard, and I'll actually, if I can, take you out to that. What's the right one here? So this is the substance use in Philadelphia, and they've got a data dashboard where they're sharing their information. Again, this isn't necessarily a coalition, but I wanted to demonstrate when we know what data we're collecting, and we're collecting that trend data over time. We talk about this a lot in the Graduate Coalition Academy. We're able to share that data so others can use it to tell the story about raising readiness and to engage people in our efforts. So again, it's important to be able to share that story. So the main reason that I'm sharing this, is back to the PowerPoint, hopefully, is if anybody has a data dashboard. I have yet to find a coalition that has created a good data dashboard for what's on their logic model. I would love to donate. I would love to be able to spread the word and share your example of a data dashboard. I'd love someone to put it in the link in the chat box so we can look at your data dashboard. But this is where we're going. If you attended the mid-year, Dorothy Cheney and I did a session on collective impact. Part of collective impact is sharing common data about the community. Coalitions can become leaders in this. Again, it's a way of building that sustainability of our efforts that people can track, see the data we're tracking to see how we're changing, how we're contributing to change in the community. Thank you, Brittany, for putting that in the chat box. So all that related to the fourth one, celebrate telling the story. Again, anybody have examples of one-pagers, infographics, or data dashboards where you've been able to tell the story of your coalition's efforts? I'll give folks a chance to take a breath here. We have a half an hour left, a little bit more. So you see, this is not a webinar on evaluation. It's about using our tools to tell our coalition story. So with that, I don't see anything in the chat box. We're going to move to the next one, which is recognizing. A lot of you put that, uses of an evaluation. And again, here's where that evaluation communication plan is so helpful. Ideally, we'd put at least one row, if you will, those of you that have attended week 2 for each sector or key people in each sector. But basically, the wisdom piece of this, the center column where we talk about how will they benefit, We use this data from our logic model, from our strategic and action plans, to be able to go back to the police chief, go back to parents, go back to young people and say, here's what we said we're going to do. Here's how you've been involved. We look at our coalition outputs and say, okay, to the law enforcement, you've had 32 officers attend our meetings or 32 times, and they've been involved in these efforts. We can recognize what you're doing. We thank you for helping to contribute to this change in these conditions that we've identified on our logic model. So again, the with them is really important to be able to say, what's in it for me? How do we share back to our funders to say, and our partners, the key stakeholders in the community, to be able to say, yeah, here, we are part of an effort making a difference. Here's how that effort supports what you're doing, supports what you care about. Here's how you and your organization, your sector has benefited from the work of the coalition. That's one way of recognizing our partners. Another way, if you do have, and this is in your week 2, I believe it's on page 100, 101, if you are collecting and recording data, recording information about what you're doing, you can go back, and if you've got it all on one place, you can just do a search and say, how many times have the local newspaper been involved? We can go to newspaper, say, hey, we've had 32 stories. Thank you for sharing those stories. You've been a big part of getting the work out. If we have parents and we put names here, we can say, hey, you've been involved in 8 of our strategies. We thank you for doing that. It's very helpful. So again, if we record all this information, then we're able to go back and thank people and recognize people for doing that. And with that, I want to recognize the, if I can find it, the Steuben Coalition, which is in upstate New York. And this website is in that links as well. And they've updated from 2019 is their last update. I'm hoping that they update it in 2021. Again, if you're from Steuben, let Brittany know and you can share what you're doing. She'll make you a presenter. But what I loved is they're presenting certificates of appreciation to coalition members. But if you're able to read the details of these, they customize them. They didn't just, give them a certificate. Thank you for helping the coalition. This one is saying, partnering with the coalition. This one is saying, but then some of them are your unfailing efforts in obtaining sustainability and promoting awareness. So Hilda, in this case, was involved with sustainability and public awareness. Lisa was involved with that. Here's one. This is from their National Guard, the New York National Guard. But recognition of your efforts to prevent underage drinking and marijuana use. So they talked about specific initiatives that Specialist First Class, I believe he's Sergeant King now, is involved with. Here's one where, just to go down a little more detail, in recognition for your participation in the TIPS training. So here's where they're thanking the folks. So again, we can thank people for their participation in specific events and specific activities in prevent underage drinking. So again, depending on what they're involved in, and if you think about it, if I'm being recognized, I'm going to like it when that recognized is customized and actually reflects what I did, what I was involved with. All this is from that coalition output worksheet. All this is from our strategic and action plans. Who was involved in doing the work? So I love what, again, they've gone back and each year they do it and they publicize and they're giving awards, and they're actually, when they can meet face to face, they've actually been able to share and they're having superintendent meetings. So I thank you, Steuben Coalition in upstate New York, for sharing just how you've been able to recognize coalition members. And that's a great way. Again, we don't have to go anywhere else. It's on our strategic and action plans. What we're planning on doing, it's in our output forms, our output data collection to say, here's what we actually did, here's who what involved. It's just a matter of capturing that information. And I'm going to ask, has anybody been able to share on your website, or if you put a link or document, how you've been able to recognize members for their work? Again, the more we can customize it to what they've actually done, you've contributed. Some coalitions record volunteer hours, and when they reach 50, when they reach 100, almost like, I want to say donating blood, it is different, but when you've reached certain levels, the American Red Cross gives you a note, or they note that you've donated this many times. Same thing with coalition. Let's recognize people for that. We can capture all that information on our existing forms or coalition output forms or whatever tracking we're using. And has anybody put together a one-pager of recognition for their community members? Got my gallon. Congratulations, Casey. Got my gallon pin. Again, that recognition, Casey's going to go back and give 2 gallons now. How is our coalition recognizing people for their work and to say, hey, coalition, there's some benefit. Not only they're helping my sector, my organization, personally, I'm benefiting from this. So this last piece is a plea. Again, Carrie's talking about coalition t-shirts. Again, how are we recognizing people? And again, how do we know who's participated? Let's go to our output forms, find out who's been involved. Let's go to the logs of who's been engaged in things. Let's recognize people for their work. So I'm going to ask is, and I've done all sorts of searches, and Brittany, if you have any, I could not find a one-pager or any sort of document where coalitions are acknowledging the work and thanking their coalition members, thanking their partners. I found this is for, I believe it's a grassroots housing. Here's what we've accomplished together. We have 27 associations, 2,700 and companies involved. Here's how we accelerate. Here's the impact we've had. We've accelerated safe reopenings. These are around COVID. But the point is, I cannot find any examples of coalitions who are putting together flyers or websites where they're recognizing members. And I'm going to wait here and till I see one in the chat box. Anybody have a website, or can you share a infographic where you're recognizing your coalition members? We'd love to see it. Okay, so if I'm seeing none, that means either you can't find them, or you're working on them, or we all have a task. It'd be great to be able to show, and this is what, again, a part of what the Graduate Coalition Academy is about, getting coalitions to put together this information to recognize people's work. Again, let's see how we can recognize our coalition members. Is there some way that we're doing it, both individually, like we saw in Steuben, or collectively, like this sample one page or the sample flyer? Okay, next one is building membership of the, again, we use evaluation to build member ownership of the coalition work. And this slide is basically everything we talk about throughout the 3 weeks of the Academy. Those of you that Wendy's talking about, we thank members in a monthly newsletter that goes to members and put on our website. Can't share. Yeah, so if you could even put the name of Wendy, the name of your coalition, so they can do a Google search to find how you're recognizing members in your monthly newsletter, that'd be great. Thank you for sharing that, Wendy. Did I miss anything? No. Again, let's be intentional, and we'll talk more about this in week 3 when we talk about sustaining membership. One of the, I want to give too much away, but in week 3 we talk about recognition and rewards. The reason why people stay involved is they feel appreciated. In any volunteer organization is when they feel appreciated. So let's use our products, let's use our evaluation results to show members that they are appreciated and that their work is making a difference. That's critical. Again, it's not, people are donating their time, talent, treasure, and it's being put to good use, and it's resulting in outcomes to our community, healthier and safer environment for our young people and families. Good. Cheltenham Communities That Care.org. Thank you. Thank you so much for that. We'll look that up, Wendy. Thank you. So the point is, and this is what we talk about throughout the Academy, so this is nothing new, but I did want to reinforce this. When we engage coalition members, and this is, again, we're not repeating anything you haven't heard, a community assessment in each of these products, engage coalition members in developing the logic model, is they're going to own this, they're going to own the evaluation and be able to do the things that we've already talked about, pull information from these documents, if they know what they are, if they've seen them, to help tell the coalition story. So again, I'd love to hear in the chat box, but how you're engaging coalition members and working on these products. And just some examples, and this is, again, we've covered this. One is assign a committee. So we're going to assign a logic model committee to develop our logic models. Or we have the data, we've already got the assessment, or we're going to develop we've identified our logic model, we've identified a party local condition. We're going to develop a committee or a short-term action team that's going to meet 3 times to develop strategies. So we can build them throughout the process, build these work groups, these action teams to do work. That's one way of engaging coalition members. Heather's talking about we've established a data task force comprised of many community members to collect the data. They're going to own that. They're going to be able to use that data because that's the data you're putting in your evaluation plan. That's the data you're going to track. So where'd that go? Who's Heather, I believe, the data task force. Heather, if you can create, even if it's on paper, but a data dashboard, here's the data we're collecting and tracking over time. That's going to show we actually use this data. It's not just a one-time deal. Excellent. Thank you. We organize members on Facebook and Instagram, picture why they are a member. And again, that's, thank you, Melissa. That's sharing, and again, showing how I'm involved with the coalition. Another way that coalitions are engaging members in these products is they don't have to necessarily be involved in creating the product if you have a work group, but have coalition members be involved in either critiquing a product, editing a product, prioritizing. So you can say, here, we've identified these 4 local conditions. Here's the data. What we want to do now is engage all coalition members in prioritizing which one should we take on first. So again, they didn't have to be involved in the assessment or even developing the logic model. They just know that at the coalition meeting, we're going to prioritize and have discussion around these 4. So having people involved in prioritizing, or we've got our logic model, we've identified our priority strategies, we're developing strategies. We need the coalition to prioritize which strategy we do first, or which strategy do we have resources to take on now. So prioritizing or editing. At a coalition meeting, take your community assessment, break it up into 4 pieces, break your coalition members into 4 pieces and say, edit away. What do you like about it? What do you not like about it? People, you're getting people to read a manageable piece by providing feedback. They're going to own that. They're going to want to see how that's used. So whether it's your strategic plan, share the strategies for each local condition with members at a coalition meeting and say, what's your feedback? Do you think this will work? Will this change this local condition? Will this achieve the short-term objective that we've identified? The whole point is if we engage people in, they don't have to be creating these products, but reviewing, prioritizing, editing, they're more likely to see the information there and then use the data for these reasons that we've noted. And Melissa, thank you for sharing your photos of your coalition members. Excellent. Any other ways that you've been able to engage coalition members actively? Another example is when we borrow heavily or steal from other coalitions is some people, or I don't want to say are competitive in nature, but some coalitions, if you say, here's this coalition, beautiful logic model, we can do this. See, and then here's how they're using it to develop strategies. Again, if you go out to our friends from Milton and say, hey, they won Coalition of the Year, here's what they were able to put together to be able to tell their story. I guarantee you have coalition members are going to say, we can do that. We have this data. We have to report the core measures. We have to report on DFC-ME. We can do this. So again, share examples from other coalitions. Again, in your academies, ask for coalitions to share their work. Many of you are doing this here. Again, thank you for those of you that have done that. Any other just examples of how you're engaging coalition members in owning, really it's being knowledgeable about these products. When they're more likely to use the information on these products for, again, these 7 reasons that we've identified. Okay. We're down to the last reason, which is the most practical for those of you who are attending the National Coalition Academy. You need to have these products to graduate. And so here's our review in the next 5 minutes or so, is our review of the product. Hopefully what we've done here is, hopefully what we've done here is demonstrate that these products are useful for all these other reasons. And we're not just having you do these so you can say you graduated from the academy. There is a use for every one of these products. We know that the products all build off each other. And when we talk about evaluation, there are these four, this is our review. There are these four elements. The first thing is to document the data on your logic model. And again, we talked about 2 pieces of data. And those, again, here's where your coalition development support can really help you. I've spent a good conversations with folks tweaking local conditions to be able to identify data that we can track over time that'll be able to say, is this local condition changing? For those of you that I've chatted with, many of you are on this call, thank you for putting in that extra effort to say, how do we really get good data on our logic model? Again, sharing and building Melissa's relationships during NCA has been so much fun, even on Zoom, right? Let's just share 2 pictures and or 2 pieces of data and say, what do you know about this? What can you add to this? Zoom is a nice way of, can be a nice way of, again, as we sharing examples of what other people have done. So the first part is confirm the data on your logic model. When you have good data, that's our evaluation plan. This is, again, I said earlier, it's only 14 pieces of data we have to collect over time for a given logic model if we have a 2x4 logic model. And we can track, we know our baseline data, even if it's qualitative data, we can start to say 8 focus group members of this group of youth said one thing. We had a similar group 6 months, a year later, only 4 are saying the same thing. That's one piece of data that tells us things may be changing. And then finally, document our coalition work. This is from, again, week 2. It probably would have been what, day 3 of week 2, morning or afternoon, where you're talking about evaluation. These are those outputs where how do we document our coalition members and staff our work. That's why, again, you don't have to use our forms, but however you're tracking your work in detail, that shows here's what our coalition members are doing. Here's how we're contributing to change. And this is a great way of engaging folks at every meeting. Say, just on the back of your name tag, if it's a face-to-face meeting, write down and have a form, write down all the things that you and your organization have done to contribute to creating healthy communities and safe places for our young people, or to our strategies on our logic model. Again, let's record this information. And then finally, it's how we tell the story. Here's our simplified, I'm stealing from week, you've seen this. Here's our new logic model, telling a story, give us data, we all win. That sounds like a good logic model, but I mean, give us money, we all win. The only reason they'll give us money if we're able to say, here's the need, here's how we're contributing to the need, here's how our coalition is unique. But when we have all this data, we're able to share that. And again, your evaluation plan is how you're telling the story to key stakeholders. So again, those are the 3 parts of a coalition evaluation. And it's, again, building off everything we just talked about in weeks 1 and 2 of our academy. And again, telling the story is really what you'll hear about when we talk about sustainability in week 3. So again, I'm going to ask you all, we are toward the end of our finish a little early, but that's okay. I'll just ask you all, sharing and building, what are some of the key points? And if you've had anything reinforced, to just reinforce for you, or anything new, or any ideas or any questions. This is our third to last slide. Key points that you pulled out of today, or other questions that you want. I can pass these on to your instructors and to the coalition development support folks. Any key points from today? Key thoughts, or key even just examples that you've been able to borrow from others?
I'll add, Dave, that I think it's really interesting the addition of, as you're talking about the key documents that we have people submit, your inclusion of the coalition output worksheet here and how important that is to building your evaluation work, right? We have people turn in those other documents, but we don't have.
Thank you for bringing that up, Brittany. What's interesting, some of you may have attended our previous academies. That's one thing that has changed. That used to be one of the required products, and we changed for some reason. Maybe we want to revisit that as a required product. So.
Not for this year. Don't worry, folks. We won't change it this year.
Again, if you are able to contact, I'll go to the next slide, your coalition support. Every academy cohort has either Rick or Kim or me or Joy. Please contact us. You can contact us directly or at, understand CADCA has a new phone number, so we will replace that coming up for our support.
I think it's just a temporary one, Dave.
So training@cadca.org will get you feedback. We have someone dedicated to referring to that. Thank you for that, Heather. That's a nice summary of what I was hoping to do, to exercise, to think about which of these products to turn on for different reasons. That's the whole purpose of today. That sums it up. And again, the whole point was, if we're using these products, there's not a lot more we have to do these things that are all part of doing an evaluation. And speaking of evaluation, and thank you, Brittany, there is in the chat box a link to the evaluation for this session. It's the first time I've trained evaluation this way, so please provide your feedback. It will be very helpful to tell me it worked, or maybe it didn't work. Let us know. Yeah, and thank you for that. On the hopefully I'm pronouncing your name correctly. They're all linked together as opposed to just separate products we have to do for graduation. That was another goal of this workshop. So thank you. And thank you for putting that wording on there as well. So with that, I thank you all. We will stay on. We're done a little bit early. No one will argue with that. But we'll stay on if people have questions or comments or been able to dig up something and you want to share in the chat box. We'd love to borrow heavily from you. Thank you all. Thank you, Leanne. With that, thank you all very much. Please contact your coalition development support if you have any questions about any of these products. And we'll see you at your next week 3 coming up. I know they're all scheduled for the summer and fall, so thank you.